Hello guys, I hope all of you are doing well and I welcome all of you today to the week 6, that is rest of antimicrobials. Now, all of you know that we could not do it last Sunday because again, there was a problem with my health and I got infected once, then I again got reinfected. Now I'm getting in the line because this is the season of flu and other respiratory viruses including COVID viruses. So you guys also take care of yourself, stay safe, right? Anyway, so this video I'll be premiering it, and next one I'll try to do the session as a live session. Next one, right? So, guys, today rest of antimicrobials. With this session will be done with total antimicrobials, antibiotics. I did the live session, right? So let us not waste time and move on to today's session, guys. All right, coming to the first question, guys, as you can see on the screen, a 37-year-old woman diagnosed with pulmonary tuberculosis was started on standard regimen with first-line drugs, after which disease marginally improved. Thus, susceptibility testing was done, which showed resistance to isoniazid, and it was due to its impaired activation. So it is not being activated. Where? That is what you have to think, right? Which of the following gene might be associated with resistance in this case? Right, which gene? What do you think, guys? What is the answer? So you can take some time, ponder upon, and then let me know the answer. What is the answer here? So again, this is an MCQ that has been asked in our exam recently in one of the INICET. I've changed it, made a clinical case out of it, right? Now see, isoniazid is inactive, and inside a bacteria, whenever isoniazid goes, it is activated into INHA or active isoniazid, and for this, I need an enzyme called as catalase peroxidase. Now, it might have clicked you. They had asked you an image-based MCQ where there was a drug which was being activated by this enzyme. They had asked you which drug is it. The answer was isoniazid. Now, see, catalase peroxidase is a bacterial enzyme that is coded by a gene called as CATG gene, right? CATG gene. So, if CATG gene undergoes mutation, this catalase peroxidase changes, and because of which isoniazid is not activated into INHA. So, if you have not commented the answer, can you at least comment the answer now? Is it due to CATG, CASA, INHA, RPOB? What is that, guys? So, it is CATG gene, right? So CATG gene, it is responsible for severest resistance. So CATG gene mutation causes severest resistance. That is one MCQ. INHA gene, there is overexpression, and this gives us cross resistance to ethionamide. So cross resistance of isoniazid to ethionamide. So these are two important MCQ points. One is severest resistance, where there is impaired activation. It is due to CATG gene mutation. Which mechanism isoniazid develops cross resistance to ethionamide, a second line drug? Your answer is INHA gene overexpression. So guys, this was not a difficult MCQ. I've taught you this in detail in my lectures, right? Now moving on to the second question. Which of the following statements is false regarding treatment of resistant TB with oral only regimen, right? So this is a new MCQ that I made here for you guys. So as I said, in these sessions, I'll be discussing new MCQs, right? Option A, look at the MCQ. Taken with food. Care should be taken in patients of arrhythmia. Contraindicated in pregnancy. Most important drug is bactericidal. So what do you think, guys? What is the answer here? So take your time. These are new type of MCQs, and such MCQs is a moderate level MCQ. You should attempt such MCQs in the exam. Now, if you look at these options, right, oral only regimen. So first thing that should strike in my mind is about which is the oral only regimen that is used in resistant TB nowadays. It is bedaquiline containing oral regimen. So this MCQ is mostly about bedaquiline. right? It should be taken with food, yes or no? Yes or no? Yes. Bedaquiline, delamanid, pretomanid, all should be taken with food, right? Care should be taken in patients of arrhythmia, yes or no? Yes. That is the reason why, because bedaquiline and delamanid, these are three drugs which can cause QT prolongation. So I should avoid them, to be specific, in arrhythmia. Contraindicated in pregnancy, yes or no? What do you think? All right, let us leave this question. Let us come to option D. मैं काम कर रहा हूँ भाई. Anyways, let us come to option D. Most important drug is bactericidal. Now, what do you think about the drug being bactericidal? Is it true or false? Now, see, if you remember, today, what we are doing is we are trying to eliminate tuberculosis, and the program is called as NTEP, National Tuberculosis Elimination Program, and that is precisely because we have drugs like bedaquiline and delamanid. And why we are so confident that we can eliminate TB is because both of these are cidal drugs. So bedaquiline, delamanid, pretomanid, oral cidal. So no, it is not contraindicated in pregnancy. Out of the three new drugs, bedaquiline, delamanid, and pretomanid, as of now, I have evidence, yes, only against bedaquiline, that it is safe in pregnancy. So this is using all this information, I had made this MCQ. If you go wrong, it is okay, it is fine. In these sessions, I'm not here to judge you guys. It's just to ask you some new MCQs by which I can tickle your brain, as I say, right? All right. Moving on to the next question. Pyrazinamide is a first-line drug given for only first 2 months, and this then discontinued because of. So guys, if you look at the regimen for TB, that regimen for TB is for 2 months and 4 months, the intensive and continuous phase, and it is HRZE followed by HRE. So you can see what disappears. What disappears is Z after 2 months. So the MCQ is why it is given for only first 2 months, right? Look at the options. Hepatotoxicity, limited activity beyond 2 months because it can cause gout or high cost. So what do you think is the answer, guys? It's not a difficult MCQ. It's an easy one. In fact, I have taught you this. This is not, I'm not asking something new that you don't know, right? So why? The reason is here, the answer is because of limited activity beyond 2 months. Limited activity beyond 2 months. So why there is a limited activity beyond 2 months? Why there is a limited activity beyond 2 months? The reason being, see, pyrazinamide is a drug. Pyrazinamide is a drug. Whenever it goes inside a cell, so this is one of the cells in my lungs, respiratory epithelial cell, suppose. So inside the cell, whenever it goes, pyrazinamide, it must be activated. And for pyrazinamide to be activated, it needs an acidic pH in your respiratory epithelial cells, right? Now, normally, do we humans have an acidic pH in the respiratory epithelial cells? No. So what is that gives us an acidic pH? What gives us an acidic pH is an active inflammation. An active inflammation gives us an acidic pH, and that active inflammation is present only during the first 2 months. So if I give pyrazinamide beyond these 2 months, because there is no active inflammation which have subsided, giving pyrazinamide would not give me much benefit, rather would give me unnecessary side effects like hepatotoxicity, gout, etc. Right? So answer is option B, guys. Answer is option B. So as I said, it's not a difficult question, it's an easy one. Now moving on to the next question. A patient was started on treatment of TB and he developed following side effect that is given in the image. And which of the following statements is correct regarding the same, right? Stop isoniazid and restart once side effect resolves. Stop isoniazid forever. Stops rifampicin and restart once side effect subsides. stop rifampicin forever. So first of all, I need to appreciate what's there in this patient, the limb of this patient. What can I see? What are these? So guys, these are petechiae. And this petechiae, they are seen because of a decreased platelet count or thrombocytopenia. So first thing I need to understand, thrombocytopenia is the reason why this patient is having petechiae. And it has been caused by which drugs? Drugs used for TB. Obviously, we started on first line. Now, first thing is, which drug can cause this? It can be caused by rifampicin. So, two options are gone. A and B is gone, right? Now, I'm remaining with C and D. And which one do you think is the answer? C, stop rifampicin and restart once side effect subsides. D, stop rifampicin forever. Now, I think it should be a cakewalk. Again, this is a moderate level MCQs. If you've gone through my lectures, you can easily answer this. I've told you two side effects where rifampicin should be stopped and never restart, right? Sorry, I marked the wrong option. Stop rifampicin forever and never restart are a decreased platelet count. So, stop rifampicin permanently for two things. If there is a decreased platelet count or thrombocytopenia, plus if the patient has a pulmonary syndrome. So remember, P for permanent, P for platelet count, P for pulmonary syndrome. So that is my answer, guys. So this is not a difficult one. Now moving on to the next question, a clinical case I made for you guys. A 27-year-old drug abuser suffering from AIDS was brought to the emergency department with high-grade fever, headache, confusion, nausea, and vomiting. On examination, there was nuchal rigidity, diplopia, and loss of vision. An agglutination test of the spinal fluid for capsular polysaccharide antigen turned out to be positive. Which of the following treatment would be most appropriate for these patients? Amphotericin B and fluconazole, amphotericin B, flucytosine and fluconazole and ceftriaxone. I don't think it's a difficult one. The question might look long, right? So जो लंबे चौड़े question होते हैं ना, वो असल में आसान होते हैं, right? So the longer the question is, they're easier. So first of all, I have to make a diagnosis. And what is the diagnosis in this patient where capsular polysaccharide antigen test is positive? Guys, this is a case of cryptococcal meningitis, and all of this we know from micro. I have no doubt that you guys are smart in micro, right? Though it's a difficult subject. So once you have made this diagnosis of cryptococcal meningitis, all right guys, can you let me know the answer? Which one is the answer? Is it A, is it B, is it C, or is it D? What do you think? Come on, let me know in the comment box. Come on, fast. Let me know in the comment box. All of you must comment. What is the answer? A, B, C, or D? All right. Cryptococcal meningitis, some of you guys might have jumped onto amphotericin B. It's an innocent answer, but it's not the right answer, right? Amphotericin B alone is not the right answer. Why? Let me tell you. See, in cryptococcal meningitis, the drug of choice is obviously amphotericin B or liposomal amphotericin B, but I must combine it with flucytosine, right? That is the best thing I can do. This should have been the best answer. But if flucytosine I don't have in my hospital or in the area where I work, it is not there. In place of flucytosine, I can replace it with fluconazole. So because of that, in this MCQ, my answer becomes amphotericin B plus fluconazole, right? Option A, right? I've given you the option A as right answer here. So anyways, those who went for amphotericin B as an answer, don't feel guilty, right? So such MCQs, how do you feel after you solve? कैसा लगता है? क्या यार, मतलब आंसर आते हुए भी गलत हो गया, है कि नहीं? It happens. It will happen in the exam as well. It's a bitter pill that we have to swallow, right? Anyways, guys, come on, let's move on to the next MCQ. Which all of the following drugs are used for treatment of vaginal candidiasis except? So in this MCQ, we'll learn the right answer, plus I'll teach you some updates in vaginal candidiasis. Come on, guys, come on. Let me know the answer in the comment box. It's not a difficult one. It's an easy one, right? All of you know that. So which one is the answer here? Is it fluconazole, oteseconazole, ibrexafungerp, isavuconazole? Which one? Which one? What is the answer, guys? Come on, let me know. So, guys, all of you know answer is isavuconazole. Isavuconazole is approved only for treatment of mucormycosis and aspergillosis. Right? There is only two conditions where it is approved. Fluconazole, vaginal candidiasis. It is the drug of choice for. It is the drug of choice for vaginal candidiasis. Oteseconazole, ibrexafungerp. Oteseconazole, ibrexafungerp. These are used for treatment of recurrent candidiasis. So I should not start my treatment with these drugs. Fluconazole, if the patient is having repeatedly, then in that case I can use oteseconazole or ibrexafungerp, right? So this is what we learned, guys. These are two new drugs, oteseconazole, ibrexafungerp. They have been approved in the last 2 years, 2021, 2022, somewhat there. And because recurrence nowadays is getting quite frequent, so I have a hunch they'll ask these two drugs in the upcoming times. Don't get surprised if they ask in INICET. A 62-year-old male suffering from diabetes mellitus and chronic renal insufficiency presented to the OPD with symptoms of urgency and frequency. He was diagnosed as a case of BPH and he underwent TURP for same. After 1 week, he developed high-grade fever with chills. Though he was given antibiotic prophylaxis, urine culture test shows growth of candida. Sensitive to most systemic antifungal drugs, a drug with which of the following mechanism of action will be preferred here? Right. So, here's a high-grade fever with chills, right? UTI, and he might be going into, urosepsis. And which one I'll be using? A, sequesters ergosterol. B, block of beta-glucan synthesis. C, breakdown of fungal DNA. And D, inhibition of microtubules. So guys, what do you think? What should be the answer here? Come on, comment. Don't look at me. Comment the answer. Let me know what is the answer. All right, so what does it qualify under? Is a systemic infection of candidiasis. And if there is systemic infection, I'll always use liposomal amphotericin B. And liposomal amphotericin B, what it does, it sequesters ergosterol. So the answer here is amphotericin B. So I've turned this MCQ upside down and I've asked it with respect to the mechanism of action. So sometimes they do ask such MCQs. So this is another clinical case, guys, which we have discussed. So remember, for systemic fungal infections, fluconazole is not the drug of choice for candida. For example, they ask you about candida causing UTI with systemic symptoms like fever, etc. They ask you about candidemia, blood infection. They ask you about candida causing meningitis. All of these, your answer will not be fluconazole. Your answer would be liposomal amphotericin B, right? All right, look at this question. Clinically relevant one. This is how the MCQs are being asked nowadays. A patient should be asked to drink plenty of water along with all of the following drugs except endinavir, acyclovir, tenofovir, sulfonamides. A patient should be asked to drink plenty of water along with all of the following drugs except. Take your time, think for a while, let me know what is the answer. What is the answer? What is the answer, guys? Come on, think. What is the answer? All right. When would you ask a patient to drink plenty of water? When you worry something is going to precipitate in the renal tubules and can cause renal stones. And these are usually the crystals of drugs. So for any drug causing crystalluria, I would always ask the patient to drink plenty of water. Mind it, plenty of water, not beer. Because this is one of the misconception कि beer पियो और किडनी का स्टोन ठीक हो जाता है. ठीक है, बियर पीने से किडनी का स्टोन ठीक होता है, इसका मतलब थोड़ी है कि भाई दरुए बन जाएं और पता चला बाद में ये ठीक किया, कोई दूसरी बीमारी ठीक करते करते अल्कोहलिक बन गया हो, बाद में डाइसल्फिरम दे रहा है उसको, राइट? So crystals. So we'll ask plenty of water. So basically, I'm asking which of the following drugs will not cause crystalluria. Indinavir, it causes, yes, it has been asked plenty of times, right? Acyclovir, does it cause? Yes, it has been asked. They had asked you which drug causes obstructive renal failure. Acyclovir. Sulfonamides, yes, they do cause. So what is the answer? Tenofovir. Yeah, you might think tenofovir. Tenofovir is how it is possible. I should drink plenty of water with tenofovir. No, you drink normal water. Tenofovir, yes, it is nephrotoxicity, but drinking water, too much of water will not prevent it as such, right? All right, guys, moving on. Next question. Myoglobinuria can be seen with. So I've included some one-liners as well because your paper is a mix of clinical questions, one-liners, everything is there, right? Myoglobinuria can be seen with zidovudine, raltegravir, rosuvastatin, all of the above. So whenever I say myoglobinuria, it means actually means what it is a result of what done by the drug. Myoglobinuria, it is a result of myopathy. It is a result of myopathy. So all I'm asking to you guys, which drug causes myopathy? What is the answer? Let me know the answer in the comment box. Come on. Comment. What is the answer? Zidovudine, raltegravir, rosuvastatin, all of the above. What do you think is the answer? Guys, zidovudine, does it cause myopathy? Yes, it can cause. Raltegravir, R for raltegravir, R for rhabdomyolysis. I taught you like that. Yes, it can cause. Rosuvastatin, this is statin. All statins can cause myopathy. So what is the answer? All of the above. Never underestimate the power of all of the above. All of the above is very powerful, right? So nowadays you don't get such MCQs, right? It was a saying in our times when I appeared for the exam that the moment you see all of the above or none of the above, then don't apply your cortex, just apply your spinal cord and go for all of the above or none of the above. Now I'm just joking. You should look at all the options and then find the answer. That was because most of the times the answer used to be all of the above or none of the above. So this was an easy one, guys, right? All right, let's have a look at the next one. Is it easy or difficult? A 45-year-old male suffering from AIDS for the last 5 years is on first-line treatment of AIDS. He presented to OPD with symptoms of dyspnea, fever, non-productive cough. He was diagnosed as a case of CMV pneumonia and started on an intravenous drug. The drug that he was started on is valganciclovir, ganciclovir, acyclovir, valacyclovir. Guys, what is the answer? What is the answer? This is an easy one. I won't even say this is a moderate one. This is an easy one, right? So what is the answer here? Now look at this. The clue here is it was started on an intravenous drug. And if you answer valganciclovir, again, it's an innocent answer, but it's not the right answer, right? So the answer here is ganciclovir. So see, by oral route, I prefer valganciclovir more than ganciclovir. By IV route, I have only ganciclovir. There is no IV valganciclovir. I don't need actually that because by IV route, absorption is not a problem. All of you know that, right? All right, guys. So moving on to the next question. A patient was started on a drug that he developed nosebleeds. And he developed nosebleeds. All of the following drugs could be the cause except zidovudine, ganciclovir, linezolid, oseltamivir. Again, it's a clinical MCQ. Now these drugs, they have been asked in different ways. I've just changed the way by which, because this is how a patient might present to you with nosebleeds after starting 3 drugs. Which one is not that? All right. Oh, I see. Nosebleeds can be seen because of a decreased platelet count. Decreased platelet count can be due to bone marrow suppression. Now, can you at least comment and let me know the answer now? Can you please? Zidovudine, can it cause bone marrow suppression? Yes. Ganciclovir, can it cause? Yes. Linezolid, can it cause? Yes. So A, B, and C, all of them they can cause. But can oseltamivir cause? No. So the answer is oseltamivir. So zidovudine, ganciclovir, linezolid, all of these drugs, they can cause bone marrow suppression. Linezolid does not cause. So oseltamivir does not cause. That is the answer here, right? So an easy one, guys. A 37-year-old drug abuser presents to the OPD with complaints of diffuse pain in abdomen, which is at times associated with foul-smelling diarrhea, alternating with constipation. The symptoms started after his visit to a concert where he had some street food. Stool examination revealed organism given in the picture. Now, if you look at this picture, everything is clear now, right? She was started on a drug that inhibits ATP synthesis. Which of the following drugs the patient was started on? So, guys, all of you know the organism you can see here is Giardia, right? So, Giardia does cause diarrhea. What is the answer here? A, B, C, D, benznidazole, metronidazole, nitazoxanide, rifampicin. Let me know the answer in the comment box, guys. Come on, come on. All of you must comment. All of you must comment. Let me know the answer in the comment box. What is the answer? Now, some of you might go for metronidazole. And again, that is a superficial answer. You looked at giardiasis, you pounced upon metronidazole. That is not how things work in MCQs. You have to focus on this ATP synthesis. Metro has nothing to do with ATP synthesis. It produces free radicals that damages your DNA. So it has nothing to do. It has nothing to do with your ATP synthesis. All right, can you now let me know what is the answer? It is easy, right? Your answer is nitazoxanide. So nitazoxanide inhibits PFOR, pyruvate ferredoxin oxidoreductase, which is an enzyme present in the mitochondria of Giardia, where it blocks ATP synthesis. So nitazoxanide, it is drug of choice for cryptosporidiasis. It can also be used in drug-resistant giardiasis, metronidazole-resistant giardiasis. So answer is nitazoxanide. All right, next question. A 6-year-old girl was brought to the pediatric OPD by her grandmother with complaints of abdominal pain, perianal pruritus since 2 weeks. The grandmother also said she saw some worms in her granddaughter's stool yesterday. On placing a cellophane tape swab on perianal area, it demonstrated eggs, which can be seen in the picture. This kid should be started on metronidazole, albendazole, ivermectin, praziquantel. So what is this, guys? What is the diagnosis? I don't think, you guys will have any difficulty. Enterobius vermicularis, that is also called as itchworm, and that causes perianal itch, mostly in the kids. And what is the drug of choice for that? All of you know that. What is the drug of choice? Albendazole. So this is an easy MCQ. This is not a difficult one. Now this is a moderate level MCQ. A 32-year-old Delhi laborer who has migrated from UP to Delhi presented to the Safdarjung hospital with a diffuse skin disease. On examination, there were macules, nodules, and plaques all over her face as given in the image. She was diagnosed and an appropriate regimen was prescribed. Drugs with following mechanisms can be started except, right? Now this is why the MCQ might be difficult for you guys. So basically, if you look at this picture, this is a picture of leprosy, right? Except is the word. So don't forget except. Protein synthesis inhibition, RNA polymerase inhibition, DNA gyrase inhibition, cell wall synthesis inhibition. Right. Now giving you some time. Please do let me know the answer in the comment box. Take some time. Do comment the answer. What do you think could be the possible answer here? A, B, C, or D? All right. Protein synthesis inhibition. Yes. For example, I use minocycline and clarithromycin. These are protein synthesis inhibition. RNA polymerase inhibition. Yes. I use rifampicin. DNA gyrase inhibitor. Yes. I use fluoroquinolones like moxifloxacin and ofloxacin. Cell wall synthesis inhibitor, I don't have, no. So any cell wall synthesis inhibitor, they are not used, they are not active in leprosy. Now this MCQ, if I would have given you direct drugs, it would have been a much easier MCQ. But as I said, in this sessions, I'll discuss MCQs which are new, which are different. Some of them are difficult as well, right? Now moving on, guys, to the last question for today's session. Which of the following drugs can be used for treatment of influenza as an oral single dose? Oseltamivir, zanamivir, peramivir, baloxavir. This is a difficult MCQ. But if you know the power of ruling out, if you have the art of ruling out, you can find the answer. right? Tell me now, guys. Come on, let me know. If you have no idea, you should still make a guess. You can rule out. If you can rule out one option, even one option, you should attempt. So let me know what is the answer in the MCQ box, right? Now see, guys, oseltamivir is oral, but it is given for 5 days. Zanamivir is inhalational. It is not even oral. So 5 days, not the answer. Zanamivir is inhalational. Paramivir, it is given once, but it is an IV drug. So even this is not the answer. What is the answer? Baloxavir. So baloxavir, remember, it is an oral drug used for treatment of influenza, and it is given 1 dose. I give only 1 dose of baloxavir for treatment of influenza. That is the benefit. That is the benefit of using baloxavir, though price might be a constraint. The reason being, it's a branded drug. There are no generics yet, right? All right, guys. So this is what we had to discuss. I discussed today a lot of MCQs, which are new ones, difficult ones. I gave you some easy MCQs so that I can make you guys feel good about yourself, right? So anyways, we wrapped up with this thing, the antimicrobials. Some of you guys have messaged me, sir, where is the antibiotics part? See, the antibiotics one, we did live session. So you just have to go to the live session in my YouTube channel and you'll find there the antibiotics part. So because it was not a premiere. So this one is going into premiere. I'll premiere it tonight. And endocrinology, I hope you guys are doing. I had posted on Instagram and on YouTube the schedule for endocrinology. And we'll be wrapping up that on, and on this Sunday, either I will do it a premiere, because premieres are much better, because with, live sessions are good. I know, good, they're good. But again, if there is a problem with streaming and all, as we had last time, it becomes a bit of a headache, isn't it? So anyways, coming back to this, so guys, by this we have done, now we're done with around 65% of pharma, week by week, right? The remaining, endo, FMGE, autoguide blood, those are the easier ones. The most difficult one, the elephant of pharma, has passed. And if you would have been honest with yourself, if you would have been following this right from day one till now, as I had said, read, revise, re-revise, read, revise, re-revise. If you would have been doing this, you'd know by now what is the magic it can do, right, guys? So, guys, you keep doing endocrinology this Sunday, if possible, or Monday. I'll premiere it, or I'll do a live session. I'll see what can be done. And guys, thanks a lot for appreciating these videos, this weekly pharma. And I really feel good whenever I get your messages that this is actually helping you guys. And really thanks a lot for appreciating this. Please let me know in the comment box if these sessions are helping you. So because your comments, your likes, what it does is it fires me up even to work harder, to bring something new to you guys. And I always try to do that, apart from my lectures in offline or in Marrow online, wherever it is, right? So guys, take care, and I'll see you guys this Sunday or this Monday. Lots of love and blessings.